and welcome to Growing Your Disability Community. This is number 4 in a 5-part summer series of trainings from the Systems Change Network. My name is Ted Jackson. I'm the Systems Change Network statewide community organizer at California Foundation for Independent Living Centers, and I'll be your moderator today. For more information about the Systems Change Network, you can check us out online at www.scnetca.org. So today's training is going to be a little bit different of a format. We're going to have a discussion format. Today's webinar will be a discussion to examine the experiences, best practices, and lessons learned of SCNet organizers and ILC staff working to build coalitions in underrepresented communities. In 3 sections, speakers will include the culturally relevant history and present-day connections to disability from other communities. And in our final 4th section to this webinar, we will discuss techniques and practices for strategizing and executing plans to build new coalitions for your local grassroots disability community. Coalition building strategy materials and worksheets will be provided electronically at the end of the webinar, as we talked about before. So this webinar, we're going to, as I said, do it in 3 parts. And in our 3 parts, our agenda today, we're going to start off with Systems Change Advocate from the Community Access Center, who's going to be talking to us about their experiences doing Native American outreach in the Coachella Valley in the Inland Empire. And then we're going to move to downtown Los Angeles, where an advocate from Communities Actively Living Independent and Free, otherwise known as CalLIFE, will talk about their Asian Pacific Islander outreach and how that intersects with faith communities. And then we're just going to move a little bit further south to the Downey area, where the advocate from Southern California Resource Services is going to talk about his work in doing outreach to the HIV community. I think that he'll be touching on how that branches out to several different communities and intersections with disability, but with a specific highlight to an emerging aging population and outreach possibilities there. And so without any further ado, actually first we're also going to have a question and answer period at the end of each of these sections. Like I said, they are a discussion, so we may field questions from the audience. You can chat your questions into the chat box, or you can ask your questions. But each speaker will speak for about 10 to 12 minutes, and then we'll have a specific set of time for questions and answers. So now we're going to start ourselves off with Karter Muehlig, who's the Systems Change Advocate from Community Access Center in Riverside, California. And on this slide of the presentation, there is a photograph of the outside front entrance of Community Access Center, lots of plate glass windows and 2 doors. And then, of course, there is the logo of the Morongo Band of Mission Indians, which is the tribe that they have been doing outreach with. And it is a black box with a kind of an angular but swirly configured picture in orange and yellow. And Karter might be able to tell us exactly what it is a bit more than I can. So Karter, how are you today?
Can you hear me?
Yes, we certainly can. Welcome. How are you doing today?
Okay. I'm doing well. How are you? Thank you for having me. Just to clarify, that picture is of a traditional tribal skirt spinning. So if you're able to see it, it looks like a downward view of a woman spinning in a circle, and her tribal skirt is rising to spin. So that's what you're looking at there. Community Access Center has been working with the Morongo Band of Mission Indians for the last few months. We really made a connection with them. In late spring, one of our board of directors, one of the people on
Recording in progress.
is involved in the San Jacinto Valley and in the pass over there. So he was able to make a connection with the director of social services at Morongo, and they asked us to come into one of their elders meetings, which is more of a social meeting, and it's not really an outreach opportunity. But we went in and we sat in and we spoke about our services and gave everyone a feel for what we did, and we really just let them approach us. We weren't aggressive with our outreach, and we didn't ask anything of them in our initial meetings. All we did was present the opportunities that we could help them with. After going through a few of these meetings and really building trust and starting small, they approached us to do a few modifications on their historical adobe houses. The Morongo Indians want to preserve the history of their land, and they are not adding new homes in, and instead they're really modifying the old homes that they have. And we've helped by putting in ramps and railings on a few of these homes. And we've also worked at getting some AT equipment for some of their blind individuals. Now, we found that when we go straight to the elders, we don't really get too far. The best way is to just go to the tribal halls on a day that they issue checks, set up an outreach booth, and let them approach you. Since 2004, the Morongo Indians, or I shouldn't say Indians, I'm sorry, the Morongo tribe has had a large gaming tribal facility, and so they also have a very large private sector employer base in the Banning-Beaumont area. So they don't need a lot of financial assistance, but they do have quite a few people approaching them for assistance of their own, for help. And so instead of going to them and asking for any help or forcing any services on them, we really just made it clear that we weren't asking anything but besides a connection. And once they gained our trust, they were really welcoming to letting us help out. And once we were able to get in a few ramps and railings, we made sure that we were very prompt and precise with getting them in there and making sure that they're very high quality. We were asked to come back to separate meetings, and we were able to do even more outreach. The best way to get involved with a tribe is to go straight to their social services network or their elder services network. They don't tend to need too much help with services such as Medi-Cal or disability payments or anything.
Karter, I just wanted to jump in here really quickly and just remind folks that we thank you. If you can please mute your phones if you're calling in from the phone. So Karter, I'm really interested to know, how long have you been doing outreach? What's the period of time that all this has taken place in?
Our initial meeting was in late spring, so I'm going to, it was in April or May. I think it may have been in the beginning of May, and that was one of the first social gatherings that we attended.
So you started with a social focus. I think that's very interesting. What are your thoughts around having started in a social setting with this group of people?
I think that the ideal way is to start in a social setting. Go to where they have already gathered rather than trying to gather them, because if you don't have the networking sources to obtain the folks to come in, you just go to where they're already going to be. And if you've already gained the trust of one of the higher ups, they all tend to already feel like they can trust you rather than knocking on doors saying, hey, come here, and they're like, hey, who are you? So I think it's
you bring up a really good point.
comfort zone.
You bring up a really good point, and that is building trust. What's the most important thing that you take away from this that you did about building trust?
The most important thing about building trust? Well, with I think any sort of coalition building, you have to start with trust, because if you have a similar ideal system, or when two entities have a similar focus, they're able to automatically start at that base, and from that one similarity, you're able to see where else you could also branch out.
So Karter, is there like a specific activity or something that you did, or the way that you and your director and your staff approached this group of people that you can kind of point to and say, I think that that was the beginning of building a trustful relationship?
Yes, I think the beginning of building the trustful relationship really started from day one, when the elders when we were at this social meeting, and they were asking us, well, I was told that if I buy this certain product, it will really help me. And the product that they were speaking of was an AT equipment that we had known to be expensive and ineffective. So we were honest with them, and we told them, that's an expensive option, and we feel that there's a better option that could be more cost efficient. And so once they saw that we were really trying to find the best options for them and giving them the options, that really built the trust, rather than coming in with one option and saying, this is your option, this is what you get. When you give your community different options of the services that they want, they don't feel, well, I can't speak for the community, but it seems that they don't feel as pigeonholed. They know that you're really there to help them rather than to push a certain service.
And I'm also curious, Karter, about what conversations or what processes you think that Community Access Center's relationship with the Morongo tribe went through, that you were able to identify the help that they needed in universal design in their homes or within the blind community?
Initially, when our board member contacted them, they said that they needed social services in the area for low vision, and we have an excellent senior low vision program, and that's where we had initially thought we were going to find our community base. Now, when we got there and we started outlining the different programs that we have, that's when we found that there was a really big need for the modification. A few people approached us, and it was actually the consumers that had approached us and said, well, what can I do about getting into my house or my bathroom, or wherever these modifications took place? And we gave them their options and went actually to their homes and told them exactly how it would lie out. So that we were able to identify the needs just by letting them approach us through offering our services.
Great. And so one more question before we open it up to the floor for questions. We've talked a little bit about how you started the relationship, how you let it foster, and how you fostered it, how let it grow and flourish into some identified needs. My big question is, what's next? I mean, how will this relationship grow next? What do you see happening down the line?
We are really working towards we're really working towards gaining contacts in their political leadership group. We would like to see what we could do to really get a political focus in there. That's our next step, to kind of do some community organizing and maybe start having a group that can advocate on their own behalf for the needs that they may not be getting addressed through the government.
Great. So I know that when I first heard about this, I was really excited about it because I think this is a great opportunity to build a relationship with a community that we don't normally necessarily think of for some of the same things that you and I discussed, Carter, that because of the casino on their land, that there wasn't necessarily a need for finance and a need to come to the center. They certainly had the resources to address the disability issues, financial resources to address the disability issues, but they really needed a partner in a different way to to be able to show them what they need to do and how to do it and to guide them along the way, and it can become a really great and fruitful relationship. So folks, I want to open the floor here. If you have any questions, if you're on the webinar system, please raise your hand or type them into the box. And if you're on the teleconference line, you can go ahead and unmute your phone and ask your question. And already we have a question from Daniel, and I believe that's Daniel Garcia, one of the systems change advocates at Cal Life in Los Angeles. And Daniel has the question for Carter: how did they perceive you, and were you invited to the tribal council? Good question.
Hi Daniel, thank you for the question. We were actually perceived, we were welcomed with open arms. I found everyone to be very friendly and welcoming, all of the individuals that we spoke to. We weren't invited to the tribal council. We're working towards that. So far we've gotten up to the elders meeting. We found that when you go directly to the council, they tend to kind of back off. So like I said, start small, build your way up, and eventually we will be in there in that tribal council with a representative trying to see what we can do.
Good question. All right, does anyone else have a question? Does anyone on the phone line have a question? Do they want to speak up? All right, before we move on, Carter, I just want to give you an opportunity to leave us with some final thoughts on your outreach to the Native American community in the Inland Empire, and give us some final thoughts, and maybe if you can end with the most important thing you learned in this outreach experience.
Okay, well, I have found that the band of Morongo Indians have been very welcoming once we have gained their trust. Trust is the biggest part of gaining any relationship in any community. Like I said, start small and work your way up. The tribes, like Ted said, they have the financial means to get the equipment that they need, but they are just really unsure of what to get because a lot of people see an opportunity to also gain some financial means through marketing with the tribes. So that's why it's so important to make sure that they know that you're not in it for profit and that you are here just strictly to provide them with the services that they need in order to flourish even more. And also keep in mind that not every tribe has a casino, so not every tribe has the same financial needs, and you have to approach each one in a different way. But always start with trust and always work your way up. Thank you for your time.
Great, Carter. Thank you very much. That was great advice. I think those were some great points. And I'm excited to check in with you further down the line to see how that relationship is going between your center and that community. So I want to move us on here, and of course we already just had the question and answer period. If you have any follow-up questions, you can put them in the box, and you can also email them to us at scnet@cfilc.org. And so now we're going to talk to some folks from Cal Life Communities Actively Living Independent and Free in Central Los Angeles, California. They've been doing quite a bit of Asian Pacific Islander outreach, most specifically into the Korean and Filipino communities, and then there's a connector of the faith community. And with us today we have Cynde Soto, the Systems Change Advocate at Cal Life, and we're very pleased also to have Lillibeth Navarro, the Executive Director of Cal Life. And to the right of the screen are a couple of pictures. The first picture is a photo of Cynde Soto and another person at a rally in downtown LA. I believe it's the Medi-Cal Matters rally from 2011. And then below that is a photograph of Lillibeth, and Lillibeth is holding a microphone, and it appears that she's doing a press event. It looks like there's some TV cameras, and it looks like it might be the same rally. There are people holding signs, pictures, and a lot of press around her, and she's getting attention for people with disabilities using media, as she knows very well how to do. So welcome, Cynde and Lillibeth. How are you today?
Good afternoon, Ted.
And is Lillibeth with us?
Hello.
Hello, Lillibeth. How are you?
I was the last one to say. Oh, I'm sick, but I'm participating from home.
Well, thank you so much for
Are you there?
For coming in and joining us. So I'd like, while we have Lillibeth on the line right now, and I know that she is under the weather, Lillibeth, do you want to talk to us a little bit about the Filipino outreach that your center has been doing?
Oh, okay. Well, I'm Filipino, and it seems to be logical that I bring with me the Filipino culture. I'll just give you a little bit about the Philippines. It's the only westernized and Christian country in the Orient, in Asia, and it brings the best of the East and the West. We were under Spain for 304 years, and under the U.S. for 50 years, and then we gained our independence after the Americans came to Manila. So we love America. My grandparents, tell us stories about how the Americans rescued the oppressed Filipinos. So we were under Spain for 304. That's why 97% of the Philippines is Catholic. The rest are other Christian denominations, and in the south are the Muslims, and they've never converted even with the coming of the Spaniards. So the Philippines and the Filipino culture is really like a paella. So we have the Asian cultures, like we have a lot of the Malay, Malaysian, Indonesian language and food. We have a lot of the Spanish and, of course, American. It was a trading post for many, many centuries for many countries. Anyway, when it comes to disability, we are heavily, a matriarchal society, and therefore the mother's very protective of, people with disabilities. And although there are two main beliefs about disability, the Christians believe that if you're disabled, you have a special mission, and that you are a blessing to the family. The more narrow-minded and dark ages vision of disability is of course ever present, and these families hide, their family members with disabilities, and are ashamed of them. So you see that, in the culture. When I left the Philippines, it was, I think, around the year of the International Year for Disabled Persons of the United Nations, which I'm very happy to tell you, it was like a big wave started in America, and this wave finally came to our shores. Because before that, a lot of us are hidden, and even if not hidden and well taken care of, participation was out of the question. Very few of us actually were able to participate, and those who participated, were children of affluent families. One of our heroes actually was Mabini, and he was, they called him the sublime paralytic, so, so when the Philippines puts a lot of premium on education, so a lot of Filipinos would rather have a diploma than anything else. So we're all fixated on education. Everybody, from the lowest farmer to the richest businessman, that's our national obsession, to be educated. And it served us well also that the Americans came to the Philippines, because the Asian cultures now are looking to the Philippines to teach them English. Now, when it comes to disability, and when I left the Philippines, it was a rehab model. In school, I was one of 2 disabled students, and I only saw disabled people when I started working at the local public social service agency. And I started seeing them from the woodwork, all kinds. And there were 2 things that we would give the disabled. We would give, food packages on one hand, and a little micro business loan on another. So we did not have SSI, SSDI, nothing like that. But they were supposed to account for that little loan and have something to live on. So that was just to give you an idea. Now, when the Marcos regime started, and that was about 20 years, most Filipinos were oppressed. Even my family, we had to disperse because our own economy could not sustain the people anymore, because everything was corrupt, and the powerful lorded it over, our people. So my mama had to leave, and a lot of my relatives had to leave the country. So we call that the dispersion of the Filipinos, just like the diaspora for the Jews. So when I came here and met the disability rights movement, I was very happy, and I was learning new things, because in the Philippines it was mostly from a Christian point of view, to live with your disability, learn how to deal with it, love it, offer it up, and all that. When I came to America, it was, wow, here they actually make the blind see, the lame walk, And I saw the actualization of what I was reading in the Holy Book, because people here, one thing I love about the American culture is our ability to find solutions. In the Asian culture sometimes, and also because, it was the way we were taught, you adapted, right? If you're a disabled person, you adapt to what's there. There's very little talk, although it's done, there's very little talk about changing the environment and, you know, and all that. So all the new radical ideas of the disability movement, I learned from the American disability history, and I was very lucky to have been under the tutelage of Paul Longmore and Harlan Hahn and all that. Now, so how did we reach out to people with disabilities? Well, the young disabled Filipinos here, they're very much mainstream, okay, so that there's not much, I don't see too many of them, but the few that I've seen are already, and thank God to, you know, to our movement, they already know some of the history. But what we're finding as a challenge is to talk to the elderly Filipinos, right? The seniors. It was funny because when we were reaching out to the different HUD buildings, and this was in the very, very early years of Kalais, we met them, and then they would be experiencing real difficulties at home, and they would still be in denial about being disabled. They did not want to have that brand. So it's a matter of you know, sensitizing them to that label and to embrace it as a fact of life, nothing to be ashamed about, and something to be, you know, to be proud about also in a sense. So that aspect there, and also that when it comes to politics, it's very hard to get them to get excited. I don't know if it is because of the we were worn out by the oppressive Marcos years, you know, or maybe the young Filipinos we've seen, they're already enjoying what we have worked on, you know. They take it for granted that we have these services, they, you know. But that's true of even the regular, you know, non-Filipino young people. They see it as a given because we who are pioneers, we've laid it out for them. So the challenge now is to inspire them to protect these services and even to enhance them, and also to work on a higher level, toward a higher level of jobs. One thing I love about the Filipino disabled community, and I have kept in close touch with them all these years, is their fixation on making money. Because they're, you know, they don't have government stipend, so they have to work for whatever, you know, they need. And so I kind of want that for our community, so that we're never, not never, but we're not just content with what the government gives us, but that we use whatever we have to get to the next stage. So the Filipino, how do you say it, character is also very resilient, and it assimilates. There's a joke that says, if you have an original singer and a Filipino imitates her or him, he can outdo that person. It's funny, but you know, that's how we are. So the more it's incumbent on us to really keep giving them the best. I keep, well, Filipino leaders, we have only Cantos, and only I think now is in DC. So I don't know. I probably have
no,
spoken too
not
much
at all.
already.
Lillibeth, this was a wealth of information. What I really liked about what you just shared with us was you gave the perspective of the cultural relevance in the home country that this group of people comes from, and that immigration to the United States is still an ongoing process for many populations. And it's really important to know that perspective and that history as we think about approaching communities, and we really need to know about what's important to them and what was important to them in another place that they brought here with them. And I think that that was really important for you to share that with us today.
Thank you very much.
Thank you, Lillibeth. Lillibeth, I want to ask you, if there's one thing that you think is really important for people to think about if they are to make the decision to begin to reach out to the Filipino community, what is that one most important thing?
I think if they can get the essence, the heart of the disability rights movement, it would really be good, because they can, they can be happy about the externals, like all these conveniences, but the hardest thing to break is, the let me do it for you attitude, which is great. It's sweet, depending on what developmental stage you are. And of course, when you're really sick and weak, and you would appreciate that. I don't think we should totally, snub our noses on that. It's a very sweet character. However, we need to prove to them, at least to talk to them more about how we can actually manage our lives. Because sometimes, even if you're managing your life and they see somebody helping you, all the credit goes to the one helping you. I see this in restaurants all the time, where and it's true too to many Asian cultures, and so I think it comes from a good place of the heart, but we have a disability culture that we need to make the world understand, without being angry, without being arrogant, but just understood.
That's a great point. And tapping into the independence and independent living is it's just so important for us all in the work that we do. Well, thank you very much for joining us, Lillibeth. If you want to hang on, at the end of the Cal Life section, we will have a question and answer period in case we get any questions from the audience. I want to hand it off now to Cynde Soto, who we in the Systems Change Network fondly refer to as SID. And SID is the Systems Change Advocate at Cal Life. She works for Lillibeth. And SID has worked as a systems change advocate at 2 different ILCs since the late 1990s, when funding first became available. She provides advocacy and assessment of public policies affecting people with disabilities for and with consumers and other partner agencies. Cynde considers it an honor and a pleasure to train and mentor up-and-coming advocates to create positive social change. And Sid, I want to welcome you. How are you this afternoon? Good.
I feel pretty good, Ted.
So now,
Thank you very much.
I know that one of the exciting things is that your sounds like your center at Cal Life has really been intentional about their coalition outreach and prioritized some different communities. And one of those communities is the Korean community in central Los Angeles. Do you want to tell us a little bit about that outreach?
Sure, no problem. We have 3 Korean staff members, so I think that's very important to understand their culture, and also for obvious reasons, language barriers that I may run into. And what I have found out is that the family is the most important thing for the first generation's Koreans. They have a little bit difficult time understanding Americans, individualism idea. So really, if you can get buy-in from the family unit, then you will be much more successful. Depending on the person's educational level, really determines on how they see their disability. And also their religion has a lot to do with it too. If they have maybe not as higher education, then they see their disability as a curse, as something to be cured, as something to be ashamed of. Whereas people with higher education, they see it as something that medicine can fix, or therapies, surgeries, that sort of thing. Let's see. The concept of independence and employment they believe very much in independence, not interdependence, not independence. So when someone with a disability does become employed, it really helps them with their self-esteem, as I suppose it does with anyone, really. And also, since family is so important, they usually take care of the person with a disability within their own family structure, and they're not really used to seeking social services. So that's kind of another hurdle that we have to overcome. So it's really, they see the service provider or the person at the company or agency as kind of like the authority. So, and the more training and more education they have, the more they look to the service provider for direction. And they're a little more passive. They're like passive recipients of the information or services that we are providing. So it's really better, if you're going to really help the person live independently, is to give them fewer choices of course, but with fewer options, because they will just look to you. You tell me the answer. So it's better to work a little bit in a smaller scale as far as options are concerned. That's what I have found.
How did your center get started with doing this specific outreach to the Korean community?
Well, there is a huge community of Koreans in Los Angeles, and so since we had staff members that knew the culture, knew the language, it was really pretty easy. So we found a couple of churches that had disability groups in them, and so them. And there's also the Korean Disability Association that's really quite large, and we outreach to them also.
Well, you touched two of my favorite things, and those of you who are systems change advocates, and I know that Sid will back me up on this, is that when folks come to me and say, I don't know where to go for outreach, or I'm not sure where to build a coalition, I always say, go walk around the office and start asking questions. Be curious about other people you work with, and you may find out that they have a connection. That's really awesome, because that really is the heart and core of starting small and starting where you're at and being curious about your surroundings and finding out that, wow, you've got a connection. The other thing that I find exciting about that is that when you really look at the path of almost every civil rights movement in America, it has involved some type of faith-based organization or the church. And the way that you all at Cal Life have connected the two while maintaining your independence at the same time is I really think a good example of good coalition outreach work. Sid, can you talk a little bit about that, about how you maintain that sort of separation of church and state type of thing, but also work in coalition with some faith organizations?
Okay. Well, usually their social groups they are not actually part of a worship service, or sometimes they hold their meetings at other locations, but near their temple or their church. So that it's pretty easy actually. And we don't go on Sunday or Saturday. But we do sometimes need to go to their meetings in the evening. And socialization is very important, and getting to know the families is what's paramount in our outreach. Because if you have the families buy in, then you're good to go. And of course, their ministers and pastors, we need to get to know them, because they know the issues of the people in their church, temple, and they rely on their religious leaders to guide them, and they have a great deal of trust in them.
So Sid, I'm going to move this slide here, and before I hand it off to you to talk about this next slide, Sid, I just want to mention that there are two photos on it. To the left, we have two people, one standing, one in a wheelchair, and the gentleman standing is holding a sign. It looks to be in Korean, and it looks like maybe they just attended a rally. And then to the right, we have another photo, and I believe that's the CalLife conference room. There's a long table with arrangement of flowers at the center of the table. Lillibeth Navarro, the executive director of CalLife, is seated at the table, along with other members of the Asian communities that they're working in coalition with. Sid, you bring up some really good points about respecting their worship space, but then also recognizing that their building or their congregation also serves as kind of a community center, so you can access their community in that way. And can you tell us a little bit, I know that you gave us some information here on some LA Korean area organizations related to people with disabilities that have been helpful to you all. One is called the Wheat Mission in Southern California, and the other one is Shalom Disability Ministries. Can you talk for just about a half a minute or a minute on those?
Yes, actually they're both Korean, even though the word Shalom, I believe, is a Jewish word. It is actually a Korean church. And they have tremendous programs for people with disabilities in their churches, and the buildings are accessible. They're very warm and welcoming to all people with disabilities. They have specific programs for them to help them in the home or to get assistive technology in the home. So they're very easy to work and a lot of fun to get to know their community.
Yeah, and the Wheat Mission in Southern California, their website is I'm going to mess this up, milalmission.com, MILALMISSION.com. The director and pastor is Young Sun Lee. And Shalom Disabilities Ministries is www.shalommin.com, and that's SHALOMMIN.com. And Alan is putting them out there on the chat box. And the director and pastor is Mose Park. We've got a question, and the question's a great one, and I think maybe the answer, because I kept hearing from both Cynde and Lillibeth, the family. But the question is from someone who's been trying to do some Asian Pacific Islander outreach, and it is, I'm having a hard time reaching out to the Chinese community because they are so private. Is there a way to approach this matter?
Okay. Sid, you want to go first, or?
I was hoping you would.
Okay. Well, north of Calais is Chinatown, and I would echo the what was stated in the question, which is it's really hard to break into that community. However, they have a Chinese service center, and some of the consumers actually have come to Calais. In fact, we have a good success story from a Chinese woman who we helped. She came depressed, and she was an abused woman, and then the end of it was she started working again. And but she's also, she's struggling with English, and we of course don't know Chinese. I think it all starts from the simplest contact, the simplest connection. It doesn't have to. It's not complicated. I think if we want to reach out to them, we gotta frequent the places where they are, and we also did some when we were, even before Calais, we were meeting with some groups at the Angeles Plaza, and many of them were Chinese. So even if only 20% of them understand English, have the courage to talk to them anyhow, because it's amazing what kind of sign language you can concoct, if you're really yearning to communicate. And so that's one. It's also good. I don't know how many Chinese newspapers have English, translation, but it's good to get on their mailing list. Talking about their food is really great. It's a start, For Filipinos, it's a little easier because we eat Chinese a lot. So my suggestion is get to know them. Maybe start with a clean slate. Don't think I gotta reach out to them so I can have a Chinese group. No, just maybe start with let me befriend one or two, and from the two of you can grow a community.
If I could add one thing,
yeah,
I would say that don't expect them to come to you.
Yes.
We have to go to them, wherever it is they congregate. It could be a park, it could be a church, wherever they are, go to them, and remember to smile.
Yes.
Well, that's awesome, and
by the way, just to add,
I'm going to move us along here just so that we can get to the next section, but I'm going to say, Sid, that was really, really wonderful because you reminded us that it is outreach and going out to communities. So, Cynde, you put together for us some recommendations for effectively working with persons from Korea. And these points are in your handout that you'll get at the end of the training. But Cynde, do you want to quickly review these for folks?
Okay, sure. I just have 3. Number 1 is build a positive relationship. Avoid stereotyping and labeling people. So respect their individual differences. Mm-hmm. And it's always good to learn a greeting in whatever language that you're outreaching to. I learn how are you in Korean. I'm not going to say it now because I don't want to hurt the language. I will learn how to say hello or how are you. That builds a real rapport, I think. And also remember to be patient. Relationships do not develop quickly. You need to be patient.
Yeah.
Provide written information whenever you can in their own language. We're very fortunate at our center. We have people that can write in several different languages. And it's also good if you can learn anything to promote conversation. The second one is involve consumer and family members. I think with most immigrants, their families are very important. So they value their opinion of their families very, very high. And empower consumers by teaching them their rights and responsibilities in our country here. Respect the healing rituals by the consumers and their family members. Just because something seems odd or different to you, that doesn't mean it doesn't work for them. And the third one, oops, I moved my computer too much. Oh, there it is. Expanding capacity and support. The following recommendations are made in the hope of ensuring positive outcomes for your outreach. Be creative in finding interpretations and translation services, something like what Lillibeth said, you know, little sign language and pointing and funny faces goes a long way. And also provide mental health support if needed. It could be very stressful to come to a new country and you don't really know the culture. So if you can provide any kind of assistance in that, that would be great.
Thank you very much, Cynde. That was absolutely wonderful. And I want to thank Lillibeth and Cynde both from Cal Life, and thank you for taking part in today's training. We're going to move along here, and we're going to move on to the next topic, which is HIV outreach. We're running a little bit behind on our schedule, but that's okay because we built some time in at the end, and the part that we'll be going over with some of the coalition techniques at the end is not very long, and we can eat some time there because I want to make sure that Jack Garcia has the opportunity to speak fully on his topic. So Jack Garcia is from Southern California Resources Services in Downey, California. He's actually been doing, before he came to the IL world, HIV outreach for quite a long time, as well as LGBT outreach, and that LGBT stands for lesbian, gay, bisexual, and transgendered. And so I'm going to let Jack speak for himself and introduce himself, and then after he does that, I think he's going to start us off with a video to kick off his segment. Jack, how are you today?
Fine, thank you, Ted. Thank you so much. Excuse me, like Ted mentioned. Okay, is that much better, right?
Yes, that's good. Yes.
Can you all hear me?
Oh, yeah.
Okay. I keep getting feedback here. I don't know why. Anyway, as Ted mentioned, I've worked for the past 25 years in the HIV/AIDS community, and I have a master's degree in community psychology from Antioch University. And the website that I'm going to be referring to during our discussion is a website that I put together for resources and to expand a little bit on the history of HIV and the fastest growing population that up to now has been ignored, and they are literally dying before our eyes without ever being attended to.
So yeah, I'm here. So before we move on, I just want to point out that we do have two photographs on the slide that's on the PowerPoint right now on the webinar. To the right, we have a picture of SCRS's offices in Downey. It's a one-story building with a lawn and a flower bed in front of it and an accessible walkway that goes up to a single door. And then we also have a picture of the Golden Girls, for those of you who remember them from TV in the 80s. And they're doing their famous bit of sitting around the kitchen table. And to kick off Jack's section, where he's going to talk to us about the relationship between HIV outreach and the aging community, we're going to watch a few-minute clip from the Golden Girls. So Alan will cue that up for us. Thank you.
Ready for your date, Sophia?
Blanche, she doesn't have a date.
No, I was thinking more about that time that the three of us were getting ready to go away on that Valentine's Day cruise with our steadies.
Oh, I remember that. And we were picking up some last-minute odds and ends at the drugstore. Okay, we have a suntan lotion, chapstick, and half a dozen cheap tawdry romance novels.
Well, then we're all set. We have everything we need for the cruise.
Girls, listen, maybe we don't have everything we need.
But what are we missing?
Well, we are going away for a romantic weekend to the Bahamas with Jeff and Rich and Randy. In this day and age, it might be a good idea to take along some protection.
What kind of protection?
2 armed Pinkerton guards. No, Blanche is talking about...
A Nestle's Crunch?
1 over.
An enema bag?
To the right.
Did you, Grip?
Condoms, Rose! Condoms! Condoms! Condoms!
Calm down, lady. You just get out of prison?
Yeah.
What do you think?
Well, it's not a bad idea, but I'm a little embarrassed.
Oh, me too.
Embarrassed? Well, there's no reason to be embarrassed. Now, these are discreet professionals. This is a private matter. Whatever we buy is nobody's business but our own. I'd like a package of these, please.
And, I'll take these.
No, I'll take these.
Now, that wasn't so bad, was it?
Joe, I need a price check on some condoms. These 3 ladies here want a couple of boxes of the King George prophylactics.
The lambskins and the ultra-sensitive.
2 of them have the lambskins, and the blonde has the ultra-sensitive in black.
$12.95, the black's $1 extra.
Look at all these people staring at us. Oh, this is humiliating.
I've never been so embarrassed in my life.
All right, just what in hell are all of you staring at? Haven't you ever seen 3 vibrant, healthy, sexually active women before? Now, we are embarking on a little weekend cruise with some longtime gentlemen friends, and if we decide to be intimate, then we'll be prepared. We are not embarrassed. We're not uncomfortable. We are not humiliated. We're going to walk out of here today with our heads held high, secure in the knowledge that what we have done is morally and socially responsible. Isn't that right, girl?
I have no idea who this woman is. I bought these for my brother.
Rose?
I was never so embarrassed in my entire life.
But it did turn out to be a lovely Valentine's cruise.
Well, it did not. We never even had to use those condoms.
You didn't? I used every one of mine. Late at night, I filled them with water and threw them at the people in the limbo line.
All right, folks, thank you very much. So, Jack, take us away.
Thank you. I think that just comes to illustrate my point here, and that is when we think of HIV/AIDS, we don't think of our grandparents, we don't think of our mom and dad, we don't think of our aunt and uncle who may be in their 60s and 70s, widowed, who, for reasons of just being human, are sexually active. And we don't want to believe that they are. For instance, I had a conference 2 years back, and had a panel of 6 doctors who all worked in geriatrics and did different aspects, and went down the line and asked if any of them ever talked to their patients about their sex life. And one by one, they each told me no, 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 no. And there was one person there from, I believe, Guatemala, and another one from the Philippines, and they were deliberating on how bad form or what's the word I'm looking for, improper to talk to an elder about their sex lives, because it's just something that we don't do. And here, this population, because they are sexually active and they are beyond childbearing age, there is no negotiation about using a condom or any type of safer sex practices. Consequently, what's going on is they are turning out to be HIV positive. Now, because the symptoms of HIV before it advances to full-blown AIDS mimic that of aging, when their doctor starts looking at these symptoms, they start treating it as if it were part of an aging process. Unfortunately, by the time they finally get around to taking an HIV test, it's too late, and their immune system has just totally gone totally depressed, and they are not able to withstand the cocktail that is out there at this time. Unfortunately, this population is the fastest growing. The last numbers we had, it was 28% of all new cases are in people over 60, 70, 80. This is a group that we really need to start paying attention to, and not come down and say, yeah, you know, you stop having sex, you can't do that. You know, that'd be so unnatural. But instead, educating them and allowing them to explore different options. I use this clip for the Golden Girls on my website because it opens up the discussion of, oh yeah, you know, we are sexual beings and we are going to have sex. One of the ways of attempting to work with this population is to institute a peer training program. I found that going into senior centers and trying to have this discussion, I was totally blocked out. So what I had to do was find key people in the senior community within one senior center, and who were cool with me coming in and giving them explanations, materials, so that they in turn were empowered to talk to the peers about it, to the women, the men and women there at their weekly senior meetings. So I think peer education is one of the best ways to do it. Unfortunately, the stigma is still there. So if someone has HIV in the senior community, they are very reluctant to come forth and seek any kind of assistance.
So Jack, this is Ted. You mentioned something earlier, and I do I've done a lot of outreach in different areas, and so I'm familiar with a lot of the stuff that you're talking about. But every once in a while, I got to shout out a jargon alert for other folks. Can you explain for our folks on the webinar what you mean by the cocktail?
Oh, I'm sorry, yes. The cocktail is a variation or culmination or group of HIV drugs that are currently being given on a compassionate basis and have not yet fully been authorized by the FDA, but because of its compassionate use on double-blind groups of people, they're allowing them to be used. Up to now, we've not been able to extinguish or come up with a vaccination for the virus, the best that we're able to do is control it. And that is done through the cocktail.
Great. Thank you for clarifying that for us. So now we're talking about a very interesting group here because, as we're talking about HIV outreach and outreach into the HIV community, that, as we've just learned, can also mean the aging community, can also mean young people, and especially the African American community and the Latino community, and I think that we will touch on that outreach and connection to HIV in later trainings. But the interesting thing here is that the aging community and senior citizens are so well connected right now with disability in our current outreach that this is a really fine-tuned subset. And what's your advice, Jack, on starting and beginning to reach into this community?
Well, again, as with any community, education in the form of prevention is the key here. And one of the things that I found is that women are more apt to talk about their sexuality easier than men. So approaching a group of women and giving them the materials and empowering them to then turn around and give the information off. If we could just have one set, we don't need the man and the woman to be educated, but if one set of people are educated, then they're going to learn how to negotiate a safer sex experience, and that in turn is going to be transmitted to the men in this situation. So that's how, just through experience, that's how I've been able to penetrate that group.
That's great. And is there, before we open the floor to questions, Jack, is there one thing that you think that if folks on this call and this webinar were to start thinking about beginning either an HIV outreach project or an HIV outreach subset project that specifically went to senior citizens, what's the one thing that people ought to be thinking about and considering as they start?
Well, throughout the history of HIV, there have been many educational campaigns geared at gay white males. And unfortunately, nothing came about until 10 years later for the people of color community who were being infected at the time at astronomical numbers and dying to success. And it was very disproportionate. So it wasn't until we started here at LA a campaign geared towards people of color that the education and the conversation started. Now, the one thing that I would say that really needs to happen is an educational campaign geared towards our senior population. For example, having Betty White, Larry King, and others do 15-second PSAs on safer sex practices. That would go a long way. Now, I know that's very intense and that's very broad, but you asked me what's the one thing, and that's the one thing that I see is lacking in our society at this point.
That's really, really good advice, Jack. The one thing that was interesting to me is that you were talking about going to the women, and I was thinking back in my past about 10 years ago and doing some outreach for the LGBT community into the African American community. And when you're doing that type of outreach, it was political work, but also I did a little bit of HIV outreach and going into the black church. It was through the women that we were able to be successful because the women are the caretakers. And it's amazing how, you know, sometimes there are culturally relevant things that follow, you know, several different communities. So I'm going to open it up to questions, and the first question comes from George at Drayle and Modesto, and he wanted to know if what are the stats on HIV and disability, and Jack may know a little bit more. I'll have to dig for the answer to that question, George, but what I do know is that the funding streams have been separated over time. Of course, you know, funding for the work that we do is through the Rehab Act, and the funding for a lot of the studies and things like that, as well as the care in the HIV community, comes from the Ryan White Act. And so because the funding streams are so different, there isn't a natural formulation within government to study the cross-section, and I hope that happens more. But Jack, you might be able to enlighten us a little bit more on this.
Sure. Unfortunately, the stats and the disability community is, I mean, Ted is so right. However, I will tell you that the government classifies someone with AIDS and thereby classifying them as totally disabled is less than 200 T cells within a person's system. At that point, that person more than likely is not able to work, so they will go on SSDI and require a lot of assistance. And that assistance, like Ted said, would normally come from a different source of funding, like, well, specifically Ryan White. Unfortunately, Ryan White, as with every other program, has been cut, and it's very difficult for someone to get any of the assistance that they would need to live independently. This is where our centers could come in and offer this type of assistance. And I would say one of the ways to do that is to approach HIV/AIDS organizations and just allowing them to know that if anyone needs any of their assistance, of your assistance, you're available. Now, this happened to me, or I should say to SCRS, 2 months ago. We hooked up with a AIDS education center in Whittier, and it turned out that they had quite a few consumers who were in need of wheelchairs, walkers, and commodes, and they weren't able to get it through Ryan White or Medicare, let alone Medi-Cal. So we were able to provide these through our AT program.
That's great, and that's I love the fact that you provided it through 18. You were able to make that connection through another program in the disability community that's often found in our independent living centers. So I'm going to move us along here, and I want to thank Jack. Jack has worked as a community psychologist within the HIV/AIDS communities of Los Angeles and San Francisco, and his latest research work is in a group of people who until now have been largely ignored, and yet they are the fastest growing individuals who are showing new infections of HIV/AIDS, our beloved senior population, which we are all familiar with. And now I'm going to move us along to the final portion, which will actually be fairly quick. It's where all this stuff sort of comes together. We're going to look at 2 slides. And everything that's in these 2 slides is in the handouts, and as well as being expanded even more into the handouts. And we're going to just take a quick look here at coalition strategy. Now that we've heard about a few different communities today from some of our systems change advocates and activists in the community who've been doing coalition outreach work for a long time in very specific underrepresented and unserved communities, we're now going to take some of the things that we've heard and that we've learned and think about putting them into practice and how we can get started. And that, in order to do that, we really need to kind of analyze what is a coalition. And it really is an organization of organizations united around a common issue and clear goals. However, sometimes the term coalition is used to refer to groups of diverse individuals or organizations of individuals who are involved in other groups as well. And it definitely describes a relationship between communities with a shared interest. So we also want to think about, what do we think about when we start our coalition outreach? And there's some questions that we need to ask ourselves about unifying issues, cultural similarities, differences, and thinking about our friends. What are our common goals and obstacles? What history do our communities have in common? I think we heard that a lot today. Like with the different Asian communities, we heard about the family. What barriers can we overcome to work together? Certainly we heard about stigma in several different communities. And who are our mutual community partners? And that's a thing that's very, very important. And on the next page, when we get to the worksheet, we're going to look at that. And then the handout also has some guidelines to consider about choosing unifying issues, respecting your partner's self-interest and internal process, and together deciding on your decision-making structure and common strategies that you'll employ together. Give credit to each other. It's a give-and-take relationship, so you also want to be reciprocal, strategic, and consistent. Always send that same person to the meeting so that they build a personal relationship. At the core, a coalition relationship is about the personal relationships between people. And then it's also good to formalize your agreements. Put things in writing about how you're going to work together. I've been through some experiences in the past with nonprofit organizations working together where we learned that it was probably best, if we were going to do an event or a fundraiser together, for us to put it all together in writing. And this is a workshop, or I'm sorry, this is not a workshop, a worksheet that we use in the Systems Change Network. The one that's in your packet that will be emailed out to you in just a moment, actually it'll come through the webinar system, is an accessible version, so it doesn't look exactly like this in the artwork. But for those of you who can't see this, there is, the description here is 2 egg-shaped ovals overlapping each other. One says us, the other one says them, and then in the middle where they overlap each other, it says bridges, mutual friends. And I like to think about coalition outreach strategy planning like going on a blind date. You've got someone that brings you together with another person, and the same thing is true organizationally. You want to choose your dates and your blind dates well. So there's a little worksheet that we have in here for you to figure this out. You want to identify partnership projects and events that you can work on together. Going on a date is trying someone out for a relationship, right? So you want to try out another community or an organization that you want to have a relationship or a coalition with by trying out a project. And I used as an example here, let's just say that we want to form a Fair Education Act implementation coalition. And for those of you who don't know, the Fair Education Act of 2011 puts disability history and lesbian, gay, bisexual, and transgendered history into California schools. So you have 2 very distinct communities there, the disability community and the LGBT community. And maybe something that we could do is we want to work with the GSA network, which works with LGBT youth in the schools, and we work with disabled youth in the schools. And so we identify that maybe there's this Fair Education Act rally coming up being sponsored by Equality California, an LGBT group. And maybe this is a good opportunity to have Equality California be the bridge, the mutual friend that brings us, the disability community, together with them, the GSA network, and we work on this project together. So this is just an example, and of course there's more in the packet that will be sent out. So It's time now for the handouts, and Alan, if you could please send those handouts out, please. And you're going to get a dialog box. Please remember to click yes and to save it. All right, I just saved mine to my desktop. So thank you very much for joining us today. Our trainings at the Systems Change Network are archived. Today's webinar is being recorded and will be available in 3 to 5 business days. And I wanted to just point out that we just finished a 3-part voting series of trainings: Building the Disability Vote, Organizing Meetings, which talks about putting on candidate forums, and Empowering the Disability Vote. And you can go to our website and watch those trainings there and download the materials as well. Thank you for organizing on the web with us. You can check us out at www.scnetca.org. Catch us on Facebook. We are SCNet. On Twitter, we are at SC Network, and we have a Yelp account where we Yelp about the accessibility of businesses. And on Yelp, we're SCNetCA. Thank you very much, and we look forward to seeing you at the next training. Have a good week.